Well, welcome back. October is Breast Cancer Awareness Month, and that is next month. Today, we're going to explore different types of breast cancer screenings with our next guest, Alexis Burrows, Marketing Director at Doctor's Hospital. Good morning and welcome back to Bahamas at Sunrise.
Good morning. Glad to be here.
I feel like you're a regular on the show.
Pretty much. There's always something going on.
we need to give you a segment. All right. So what is the purpose of imaging services as it relates to breast cancer?
Okay. So, when you go to your physician during your annual things like that, a lot of times, they will talk to you about doing self-examination, which is obviously the starting point that, as physicians, I think would be the intended starting point. You get familiar with how it's supposed to feel, what feels out of place, and then kind of continue that conversation. When you move beyond self-examination, then obviously you move into the space of screening. So imaging services, there are a number of different ways that you can have screening done. Obviously, the starting point for most women would be a mammogram. And that's the service that we're offering at a discount during the month of October. So that is the starting point for most women outside of self-examination for just making sure that there's nothing going on, or to if it is something going on to detect it early.
Absolutely. Which of the Doctor's Hospital Health System locations offer options for people to access?
So as it stands for our imaging service for the mammography, that's currently offered at our main hospital on Collins Avenue. We have some things in the works for expanding our imaging suite of services in terms of locations. But as for now, that is the primary one. Obviously, I think we have eyes on providing mammo in Grand Bahama, and then we have something else that I'm not sure we're able to speak about just yet, but we are looking at expanding the availability of all of our imaging services, both in New Providence and in some of the Family Islands. But for now, anyone who's looking to get their mammo done in October, it would happen at the main hospital.
Speak to the caliber of the technicians who run your lab.
So we have, I would say, the best and the brightest technicians. We hire people who go through very extensive training, and obviously they have a lot of experience in working in our space as well. I know in the last 2 or 3 years, especially during October when there's such a light shown on breast cancer awareness, we have been booked and overbooked with mammography. So obviously, you have a ton of women coming in and out every day and having screening done, so you have the opportunity to really get that depth of experience, and as you go through that, your ability to kind of pick up on different things expands, because the more you see, the more you get to say, well, I remember this kind of looks like something that I've seen before, and it becomes a point of reference. So I would say our staff, our associates, especially in that space, are highly trained. They are the best and the brightest, and I think you can feel comfortable when you come into our environment that you're going to have people who are able to, guide you through the process, not just from a standpoint of the technical expertise, but they make you comfortable. They make you feel, at home and welcome. I imagine mammos for women can kind of be, a dicey proposition. You might feel uncomfortable, but I know from what I've heard of, seeing comments and seeing experiences, obviously on the marketing side, you kind of see some of those things come up. It seems like we really do have that ability to make people feel welcome and comfortable with the overall process as well.
Which is so important, for a procedure like that.
Definitely.
Something else, I guess, just insight or education when it comes to procedures like these. Sometimes people throw around terms and you don't know what they mean.
Right.
When it's said that a woman has dense breast tissue, what does that refer to?
So what it means is that the tissue itself in the breast is heavier. It takes up more physical space, and so it's not necessarily the size of the breast itself, but it's actually the tissue within. And so what happens is, if you have a woman with dense breast tissue, the mammogram itself may not be able to detect if something is going on. So you would have then the option of an MRI, which obviously would be going a more in-depth scan, to take a look at what's happening in the breast and see if there is something growing, something that's going on that may be untoward. So that's really what it means. Typically, if you have a woman that has breast dense tissue, it just leads into a different type of scanning for things like breast cancer.
You kind of touched on it earlier, but talk about the importance of early detection when it comes to breast cancer.
Right. So anybody who is familiar with the staging of cancer, that as you get further and further along without detection, you have a harder time managing the disease, right? So early detection is critical, as with all things in health, right? The earlier you find out, the more that you can do to either arrest it or to prolong life, even if it has already gotten to a certain point. So with early detection, and this is why even before coming in to do a mammo, there is such an intense focus on encouraging women and educating them on how to do self-examination, because the earlier you detect it, the better chance you have at warding off the disease, right? We know that in our environment, in our country, we have the BRCA gene, which tends to have a higher rate of incidence for women to have breast cancer when you have that prevalent in an environment. And so you have that as a point of concern. Obviously, we know by the numerous support groups and other organizations that exist around breast cancer, it is something that you want to be able to know as early as you can, so that way when you get into the fight, you're able to fight it off as best you can. Because obviously cancer is something that can spread and can do a lot as it gets further and further on in staging. So it's much better to catch it at a stage 1 than at even a stage 3.
Absolutely. And what promotion is Doctor's Hospital offering as it relates to mammograms, breast cancer?
Right. So obviously October is Breast Cancer Awareness Month. So beginning in October and actually running through to the end of the year, so from October 1st to December 31st, we are offering a 50% discount on self-pay patients for mammograms. So you would pay $60 to get your mammo done. And if you're an insured patient, your copay is waived, so you pay nothing. All right. And like I said, that promotion runs from October 1st to December 31st. So we've pre-extended the promotion again, and that's based on kind of seeing what it's been in the last few years. Yeah. We've had to do this before, where you get towards the end of the month and you still have women calling saying, hey, I didn't get a chance to get it in on October because you guys were fully booked. And then we roll it over. But we've taken the initiative to say, no, we're going to run this promotion from October straight through December to give as many women as possible an opportunity to come in and get the scans done and get, if they find something, to be able to get ahead of the disease.
That is so important. You don't want costs to be prohibitive when you're pursuing your health,
Definitely.
which is most important. And speaking to discounts, does a LAMP membership affect this cost in any way?
Right. So because of the discount that we're applying, LAMP does not apply to this, but obviously depending on the outcome of your scan, there may be additional services that you may need. You may need to have additional scans done to further verify things like that. So obviously the LAMP benefits that apply throughout the rest of the hospital will then apply in that instance. But like I said, we're offering a 50% discount, and we're offering a full copay waive for insured patients. So it doesn't necessarily apply in that instance, but if you have the need for additional care that comes out of your findings, then the ways that LAMP apply will then kick in terms of prescriptions, other imaging tests, that sort of thing, lab tests, and so on.
Well, I want to say congratulations, sort of, and good on you for providing a promotion or a discount for a service that is so important, and so important in particular to our community.
Definitely.
And thank you for joining me to tell us about it.
Glad to be here.
And thank you for watching Bahamas at Sunrise. We'll be right back.